This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians. And today we're sitting down with Alyssa Verheyen, a nurse practitioner at UnityPoint Clinic Family Medicine, Terrace. Alyssa, welcome.
Thanks for having me.
You got the best clinic, the newest one.
Definitely.
Yeah. And, I think some of people are jealous. I've said this on a previous one. I've been by it. I haven't been in it yet.
Yeah.
So I'll have to make a point to get a tour or something one of these days.
You should come. It's really nice.
Yeah, that's what everyone's kind of jealous. But tell us a little bit about yourself. How long have you been with UnityPoint Clinic?
I've worked for UnityPoint for almost 3 years, or maybe 3 years, maybe yesterday. I used to work in the Waterloo market, and then I moved to Cedar Rapids this summer.
Okay.
And then I started at Terrace in October.
Okay.
So a little while with UnityPoint, not this region, but...
Where are you from originally?
I grew up in Southern Illinois, so a little bit south of St. Louis, but the Illinois side. So
not much farther south. And what's Cairo? Isn't that the farthest south?
Yeah. It's like maybe an hour. I always say an hour from Kentucky is like where I grew up. So.
Oh, wow. Yeah. It's down there.
Yeah, because when I say Illinois, people think Chicago.
Yeah.
Not Chicago.
Yeah, it's the Quad Cities. Where'd you go to undergrad?
So I went to Southern Illinois University, Edwardsville, which is...
Right across from
right across from St. Louis. So they have a nursing school there. I did my undergrad and then my nurse practitioner, so my master's degree there too.
Oh, it's all in the St.
all
Louis
of it
area.
there. Yep.
Is the weather significantly warmer in Southern Illinois? Probably.
I think it is.
Yeah.
I think it is.
We have a daughter who lives in Kansas City, and it always seems like it's 25 degrees.
Yeah. I always feel like it snows there, but then it melts. Here, it sticks around, obviously.
Yeah.
We get a lot of ice.
Yeah.
So it's a little bit different, but...
Yeah. This wasn't that bad a winter, really.
This one was good.
Yeah, compared to some.
Yeah.
This is my hometown, so I've put enough.
You're used to it.
Yes. So your training is nurse practitioner, but it's family medicine?
It's family nurse practitioner.
Okay.
Yep, so family medicine.
What got you interested in that? Why family medicine?
So, honestly, a family nurse practitioner was the program that the school that I wanted to go to offered. Okay. That was the school I did my undergrad at. I also, growing up in a smaller town, that's what we had. We didn't really have pediatricians. You went to family medicine. That's what you saw, and they took care of everyone. So I think that's just what I was used to and what I was comfortable with. I liked that you could take care of kids, and you could also take care of older individuals. You can do acute things. You can do chronic things. I think it was just kind of like the natural draw for me as a healthcare provider.
Yeah.
What I wanted to do. I only took care of adults as a nurse, like inpatient. But then getting to do like my clinical and things with school, I liked taking care of kids. They were funny,
So out at Terrace, you take care of the whole spectrum.
Yep. We can do it all there.
Yeah.
Yep.
Do you have any special interest in healthcare?
I enjoy taking care of patients with like GI concerns. I feel like it's kind of fun figuring out what's wrong, what's going on. A lot of times they've kind of got the runaround, or they feel like they haven't gotten answers. And just being able to read through their charts and what they've gone through and talk to them about their symptoms. I really enjoy that, giving them some answers, like giving them some hope about why they feel the way they do. So I like GI stuff. And when I worked in the hospital, we took care of a lot of like liver disease patients. So I'm like very used to that and comfortable with that. So I always thought that was really interesting. Yeah, I worked at a large hospital where they transplant, a lot. So I feel like I got to see all the really neat things.
Yeah. I always enjoyed like the chronic abdominal pain or the patient with chronic GI concerns because, there's so rewarding when you do make not for the patient, of course, but you make the diagnosis celiac or mesenteric ischemia, and you find something that can be treated better.
Life altering.
Yeah,
the way they feel.
It really is.
Yeah.
That is so true. That's fun.
Yeah.
I totally agree with you on that one. What are your interests outside of medicine?
We like sports. I like watching sports, like mainly college sports, football, college basketball, I used to play a lot of like rec sports. I'm very mediocre at all sports. Not real good, not real bad. I enjoy that. I have small children, so I feel like I'm pretty busy. Taking care of them, hanging out with them, going to their sporting events or going to the park.
What's their ages?
I have a 7-year-old and then a 3-year-old.
Oh, wow. Yeah.
So we're kind of getting into the school
getting
age.
in the busy YMCA, then middle school.
Live at the soccer field and the t-ball field right now. So, but it's fun. It's fun.
T-ball can be very entertaining.
Yeah.
Because it's like total chaos.
Yeah.
I mean, if you're going to go there to watch a competitive sporting event, you're at the wrong place. But if you're going there for just toddler chaos on an entertaining level, yes, T-ball is the sport to go watch.
The meltdown on the field.
Yes, the meltdown. The kid that just runs to center field. The kid that's playing in the dirt and not even paying attention. Yeah, those days were fun. They were kind of frustrating, obviously, for the coaches, but I was always entertained.
A lot of them, the kid just walks off the field. We're like, where'd the third baseman go?
Yeah, it's hilarious. What we always ask these new clinicians, what led you to UnityPoint Health? I mean, I think it's a great place, but how did you end up with us?
Yeah, honestly, when we moved to Iowa, I did a lot of research as a patient to figure out like where my family wanted to go for healthcare providers or for our care. And so I got led there as a patient first. And then just with our experiences, I thought it was a great place. The more you hear from like friends or from the community about it, you always hear good stories. So I was very confident when I made the decision to work for UnityPoint. I always like working more for a system. I feel like I've done like private practice, and then I've worked for systems, and I enjoy like the levels of like support that's there, the resources that are there. So I think it was a really easy answer.
It's I started in 1999 out of training, went to private practice, did that for 6.5 years, and then moved to Cedar Rapids here, etc. But, I always thought, I could always go back and do that, right? Up until about 2010. And then that's when I said, you know what, it's just too complex and complicated, and the regulations and the requirements. I don't know how these small private practices stay open, we have very few left. It used to be everyone was in private practice. So you're absolutely right. And particularly during the pandemic, it was so nice to be part of a system. You had a little resources and experts at your fingertips and leadership. And I completely get that, what you're saying there. It is, I think UnityPoint Health, we do a good job there. Yeah. Sometimes we don't make changes as fast as we'd like, but the positives outweigh the negatives, definitely. Yeah. What is one thing as you started your practice that surprised you that you really liked doing?
I don't know if it necessarily surprises me, but the older I get, I think the more rewarding it has been to help people take care of their mental illness. Just dealing with their anxiety or the depression, or maybe there's less of a stigma, so they're more open about it. I just feel like seeing them improve has been, especially with the practice now, I just feel like it's been tremendous to see it. I love seeing them come back and feel better and realizing they don't need to feel that way, or they don't have to feel that way. So I really enjoyed that lately.
Yeah,
I didn't really think would be
something that would attract you to it.
Yeah.
Yeah, I always felt that anytime I could help a patient not be on a medicine, I went home and I felt like I did something that day, just because it just seems like, you don't, there's so much more to life than medications, and the practice of medicine. So I always enjoyed that.
Yeah, I think if they don't take care of their mental health, they often have other symptoms or other problems that can get better if they're actually just feeling better. It's maybe their knee pain's not as bad because now they just have more energy, or they feel more positive about things. So
it definitely
impacts a lot.
Poor mental health amplifies. We just did a recent podcast on that, just sleep. That how we don't talk to patients. We talk about their blood pressure, the cholesterol, the protein in their urine, if they're diabetic, what their blood sugar A1C is, but we don't talk to them about how much sleep you got last night? Maybe you do. Maybe, and that's great.
I feel like
if you do.
Yeah. It's primary care, right?
Just some general questions. I do this often on the podcast where I have questions just about your practice that I ask for my own. So some of these questions maybe seem off-well, but what technology have you seen in your practice that has surprised you or you're excited about? AI. I mean, how are you seeing that play out in primary care?
I don't feel like I've seen AI in our practice, but just having them talk about how maybe with our HPIs, we're going to be able to start implementing some of that. I've seen it with the specialist using it. When they walk in the room, they just start talking and it's recorded. So that's very interesting. I feel like advancements with imaging and mainly maybe like the MRIs for breast cancer screening and seeing that more used because of dense breast tissue. I feel like that's been very interesting and just interesting learning about it and educating patients about it. So that's kind of exciting, I feel like.
See, I think the electronic health record was imposed on us with the Affordable Care Act. That was just brought us up to speed. We were so far behind other industries, right? We're still doing stuff on paper, and other industries were way beyond us. And that's because in healthcare, you have to have the big three, name, some sort of number, and then the social security number, and those have to match. And that's one of the reasons why we're so behind. But so there wasn't a lot of innovation in developing an electronic health record because it was just implemented. And I really do think AI is going to be a game changer. So you spend less time charting, and just more time with your patients. So I think I'm excited about that. Other technology questions. You didn't even expect these questions, did you? No. All right. That's how this rolls. Continuous glucose monitor sensors.
Yeah.
What brand are you seeing used by patients?
A lot of ours use the Dexcom.
Dexcom, most common.
Yeah. A lot of patients want it, which is kind of exciting, I think. The biggest thing that they tell me is they notice foods that should be perfectly fine foods maybe spike their sugar. So it gives them a little bit more insight to what they're actually eating rather than checking their sugar 2 times a day, 4 times a day.
Right,
it's more, timely. We have a lot of patients too who live in some residential homes, and I think it helps the staff know more what's going on with them because it's not a like a nursing care level of help. It's more of the the DSPs, what are they even called? But like the in-home, just kind of a helper. Uh-huh. But they can't check their sugar. They don't do those kind of things. But at least it helps them have insight to what's going on with that patient and to intervene.
And what the trend is doing.
Yeah. So that's been kind of fun.
Yeah, that's I'm excited about that too for patients. We used it a little bit during the pandemic, so nurses wouldn't have to go in and gown up all the time, or
gotcha. Yeah,
if they're in isolation, and then the FDA. I'm sure they're in the process of doing that, but they're not approved technically for inpatient use, just because of calibration and those requirements there for quality assurance. So I think that will be a big plus in that. You did good answers, spontaneous questions, not on any sort of script, didn't know those ahead of time. So impressed with your answers there, and exciting for you and your practice. One last question before we wrap up. What is one fun fact about you your patients and maybe your colleagues don't know about you?
I think it's kind of funny, but I am 5'3", but I high jumped in like middle school and high school, pretty high for a short girl. So
that's some leapers.
I think it's kind of interesting.
Yeah, that is interesting.
So that's my fun fact.
That's impressive. That is impressive. Alyssa, thanks for joining us. This was really interesting. Always enjoy having the young physicians here and asking them questions that I find interesting. I hope other people do. It was really nice having you, and you did a great job. Once again, this was Alyssa Verheyen, a nurse practitioner at UnityPoint Clinic Family Medicine, Tower Terrace. If you are interested in scheduling an appointment with Alyssa, call UnityPoint Clinic Family Medicine, Tower Terrace at 319-206-7370. That is 319-206-7370. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.